Hey everyone, I am 24 hours post-op from a septoplasty. As you can see, I had work done on my nose. It's what's considered really sinus surgery. Um, I just changed my dressing. This is something I kind of have to wear um, because my nose is still bleeding. It bled a lot yesterday after I left the hospital. In fact, I ended up going back to the ER. Well, I went to the ER last night, and they basically sent me home and told me to take a Xanax, which I was really surprised. I'm really shocked that I go in for excessive bleeding and I leave with a Xanax prescription, but apparently it's not a big deal if your nose pours out blood for 2 hours. But um, I can tell you that this morning, it, I'm a little better. The pain is not as intense. Um, you can't really breathe through your nose because you have what they call little tampons up in there. And so you have to breathe through your mouth. And so that's a little challenging at night. I've been sleeping here on the couch. And I've got several pillows propped up. So this is exactly how I've been sleeping. Um, if you try to lay down normally, what's going to happen is your mouth closes and you get woke up multiple times because you can't breathe. Or you can breathe, but you get woke up multiple times from a very dry mouth. So I've been keeping chapstick with me and a bottle of water stays next to me. And if you have any pets, um, like this one, she just lays there. She doesn't, bother me. But my other two cats like to run around and jump, and they're very playful because they're young. So if you have cats or dogs like that, you have to stay away from them. Um, you run a big risk of messing up your nose, especially after just having whether it's rhinoplasty, septoplasty, anything. Like, you really have to watch and protect your nose. Like right now, it's very swollen. If you can see, I still have the surgical marks on it. So basically, what I had done was I had this left side was collapsed, and the right side was overcompensating. So it was a like another pocket that was formed on this side because of the collapse here. I couldn't breathe at all, like barely through my nose. I say at all. I could breathe a little bit, but if I had any type of sinus congestion, I would sound like this, and I would have to breathe through my mouth. Um, so basically, the biggest reason I got the surgery done was because I couldn't breathe normally out of my mouth. And so obviously I'm not going to really know until a few days how clear it is, but my nose, I have two implants on each side of my sinus cavity that you're not going to be able to see it, but up here to widen that area so that, and they're dissolvable. So, once they dissolve, I'll be able to. So I'm hoping in about a week or two, I'll know the full effects of how the surgery actually went, and so I'm really looking forward to it. I feel like the all the suffering that I've went through thus far is pretty much worth having the surgery. Um, I'm not the most comfortable. I actually just took some pain medicine 30 minutes ago, which is why I'm able to do this video now. You're very in and out, and so if you did have this surgery and you're looking for, you're just trying to figure out like what to expect, I'll tell you that I've watched a ton of videos on YouTube before having this surgery, and the one thing that I noticed about everyone is they complained about headache, and they complained about obviously not being able to breathe through your nose for a few days. I saw a few people say they couldn't shower for a week. I'm not quite sure where that comes from. I'm actually showering tonight. They told me 24 hours not to shower, but then, go ahead and shower. Really, you just shouldn't get the little tampons in your nose, wet, obviously. But I plan on showering tonight. I haven't showered yet. Um, I've had some headaches, but they're not as bad. Tylenol has been getting rid of them. I think I had a pretty bad headache yesterday, but it's obvious, obviously you're gonna have some sort of discomfort in your head. It's your sinuses. They affect a lot of things. Um, I have well, I went into this not having very much taste buds. Um, I was losing my sense of smell and taste. And so far, I definitely don't have it back. And, I think once I'm able to breathe better and my sinuses actually start to work and everything, I'm hoping a lot of people say they get their taste buds back after a week. And so I'm really hoping that that's the case, but don't expect anything to taste like anything after the surgery. Whether you had your taste buds or not, you're not going to be, everything's going to taste bland to you, which kind of helps eat. But I've been eating vegan. They told me to stay away from dairy for the inflammatory properties that it has. Obviously, it makes your body produce more mucus. Basically, they said don't drink any milk or, limit the dairy. I just cut it all out. And I've been eating vegan since the surgery. So, and I did that too of my tonsillectomy. If you watch, I have a tonsillectomy video that I did a few days post-op and then like 2 weeks post-op or something. Um, I basically ate vegan the whole time there too, and I had very few. I don't even think I had any complications. This one, I've had a lot of nose bleeding. I've had way more bleeding with this than I did the tonsillectomy. I think I had just like a drop of blood one time, and a lot of people experience a lot of bleeding in that procedure. Um, because they have me on antibiotics, I cannot take vitamin K because the vitamin K will affect the antibiotic. So you really have to be careful with that. I think my last surgery, I didn't have any antibiotics, I just didn't give them. But this time, the risk of infection is pretty high. So at this point, I'm just having to drink a lot of water, eat vegan, just lay around for 2 days really is the best thing that you could do for yourself. Um, just know that you're going to be breathing out of your mouth for a few days and you're going to be uncomfortable. It's going to be sore. Your face is going to be a little bit swollen like this. You're going to have to wear something underneath to catch and I literally just changed this before I shot this video. So there's going to be blood, and they tell you not to drink out of straws. They tell you to take it easy, no lifting anything over 15 pounds. Um, just try to rest. And tomorrow I'm getting these removed out of my nose. So I will come back in a few days and make a follow-up video. And anybody that's having this, just be patient. You're going to feel better soon. And I'm still at that point where I'm only 24 hours post-op, so I'm pretty sore. Just take the pain medicine. My pain medicine says every 4 hours. I don't take it every 4 hours. I think that's been excessive. So I've been taking it at the very least 5. I usually get, I mean, by 4 hours, like, you're hurting pretty bad, but I try to push it out to 5, at least 5. And then, like today, I made it 5 hours and 40 minutes, so almost 6 hours. But just at the very, take it as directed. I personally, I guess I'm a little fearful of pain medication, but I'm still taking them. Just listen to your body, listen to your doctor. If your doctor says take them every 4 hours, every 6 hours, just keep up with it. Put ice compressions on your nose for 15 minutes an hour. I have not been doing that, but you know, that's what they're telling me to do to ease the bleeding. So I have been icing it as much as I possibly can. Even though it hurts really bad to put anything on your nose, just do it. I saw that some people have like these, it's like an ice mask to go on your face. Um, that's something to look into. My doctor didn't give me one. I didn't think of one. I am ordering a neti pot. So when these come out, when that stuffing inside comes out, I'm just going to be, rinsing out my nose to get all the blood out, and the dried blood and stuff. So hopefully my nose won't be bleeding as much tomorrow. But otherwise, if you have any questions, please comment below. If there's anything you'd like to share, I will post the link of the neti pot that I'm getting. It's actually a handheld. It's ceramic. I wouldn't trust the plastic. but it's a little handheld neti pot, and it just seems to be like the perfect grip and hold. So I'm getting that. I'll post it in the link below if you want to look at it. Um, Other than that, if you're going to get this surgery, just relax. It's tonsillectomies. I don't know if you ever had it, but if you have, it's way worse. But just expect some discomfort. I can't go back to work until my first post-op appointment, so I'll be working from home. But if you're able to do that, that would be great. If not, you really need to take off for the extended time until your first post-op appointment. There will be many. I have 4 scheduled, so just relax, rest, and take care of yourself. I will see you later. I will see you guys soon.